Hey Fennville, my name is Drew Glasshauer and I'm the Senior Epidemiologist for Ottawa County Department of Public Health, and I'm here today to talk to you a little bit about epidemiology as a career. I feel really lucky to be here to talk to you a little bit about what I do. I love what I do, and I just want to encourage everyone who's listening to think about working in public health or even epidemiology, just because it can be so rewarding. So I'm going to talk to you a little bit about my job. I'm an epidemiologist, which is basically a disease detective. I work for the Ottawa County Department of Public Health, and I've been in public health for almost 8 years. The last year and a half, I've been with Ottawa County, and before that, I worked out on the West Coast for another county health department. Ottawa County Department of Public Health, it does all kinds of things, including epidemiology. So we work with immunizations, we do testing at our health clinic. Some of the more common things that we do are things that are more obvious are restaurant inspections. We do well and septic inspections. We have nurses that help out new moms, and we do health promotion. So that's giving education to people in the community just to make sure that they're aware of what's going on and so that people can make good decisions for their health. And the last thing is epidemiology, which is what I do and what I love. And if you look at all these different things, one of the main themes that's common among them all is prevention. So this is what public health does. We try to prevent poor health outcomes from happening. We try to prevent diseases from happening because it's a lot less expensive if people don't get sick. And it also means that our overall population is healthier. So this is a really good investment for our community, of which epidemiology is a part. It's a part of prevention. So epidemiology is a big word. I'm not a skin doctor. If you break down the word into different things, epi is like epidermis, it's the top layer of skin. So epi means on top of. Demio is a root that's like democracy, which is ruled by the people. So if you put it all together, the last thing is logi, which is the study. Epidemiology stands for what happens or what is on top of or befalls the people. So it's the study of basically anything that's happening to the population of people, not an individual, but entire communities of people. So Ottawa County or Allegan County or a particular city like Chicago or New York or LA or even the world, like the World Health Organization's job is to do. So if we're talking about diving a little bit deeper into what epidemiology is, not just what the word is, but what the study is, it's basically a study of how often diseases or health events occur in different groups of people and why. So is the disease affecting more people in one place over another? Or is there one particular group like older folks versus younger folks who are getting sick? Is there a particular race or ethnicity that's more affected? All of these things are part of epidemiology and help us find where diseases are occurring so that we can do more to prevent it in those particular populations. We also look at not just who's affected, but why. So once we identify if there's a population that's more affected, we try to dive in to figure out what could be causing that. So that's part of what epidemiology is. And one of the reasons that I really love to do it is because I get to look at the community and be a detective to try to find out where different things, health events or diseases are occurring. Just a little bit of background about me, just to give you all an idea of kind of the road or the education that it takes to become an epidemiologist. I did my bachelor's degree at Grand Valley State University and then went to graduate school for a short time at Arizona State University and then finished up at the University of Arizona. So in all, I spent 6 years in school after high school, so 4 years in college and then 2 more years of what we call graduate school. The most helpful training were my medical classes. I took some statistics classes, which were also very helpful. And then finally, computer programming classes. So I learned different languages so that I could do data analysis and data management and data analytics. So those are 3 kind of categories of classes that were so helpful for me. You're in middle school right now, and you have all kinds of time to think about different careers that you want to pursue. And these are just a couple of things to be thinking about when you're thinking about a career in public health or epidemiology. Could you take a few more classes about medicine or about biology? Can you take a few more classes around statistics? And is there any options for computer programming classes? All good things to be thinking about if you're thinking about a career in epidemiology. So one of the cool jobs that I had coming up or as I was learning epidemiology was my internship while I was in school. At the University of Arizona, I worked with Maricopa County, which is the health department basically for all of Phoenix, working on a really unique health event surveillance for a unique health event, and that was heat death. So people that had been exposed to the elements like excessive heat and had passed away. And this is just a graph just showing the impact that excessive heat can have on a population. The red bars are the number of deaths that are occurring. And if you look at the right-hand side of the graph, it shows the number of heat-associated deaths in a given day. And then the temperature is on the left-hand side. And the top blue wiggly line is the highest temp during the day. And then the red line is the lowest temp during the day. So you can see that as temperature goes up, or if there are spikes in temperatures, we see more deaths. And in Phoenix, you can imagine it gets really, really hot, sometimes well over 110 degrees. And so we see this correlation. As temp goes up, we see more deaths. And what can we do to prevent that is part of what public health does. So some of the things that they did in Phoenix were opening oases, so places where people could go to beat the heat, places with water and air conditioning. So if you were homeless or if you couldn't get access to air conditioning, there were places that you could go to beat the heat for a day or however long you needed. So just some examples of public health, just trying to prevent these really poor health outcomes from happening. So right now as an epidemiologist, what my day looks like is different every day. So I do lots of disease surveillance. That's basically looking at the diseases in our community and counting them up and looking at which populations are affected and then sharing that with people so that they can make decisions in our community, not just here in public health, but we put this information out on the web so our partners at hospitals and clinics and other places in the community can make good decisions about prevention. I also do a lot of data analysis, so I do some computer programming so that we can take big data sets and break them down into meaningful bits of information to tell the story behind what's going on with a certain disease. I also do a lot of presentations and writing, just like this one. And so I'm really, really happy to be here with you today because one, hopefully I can inspire you to think about working in public health or in healthcare in general, but also let you know that I want you to be able to know about public health and epidemiology as you pursue your dreams, either in career or passions or volunteering, to always be thinking about public health as an option. So a lot of my day lately has been around COVID-19, and I can show you some of the work that we've done so that you can have an idea of how epidemiology is applied to COVID-19 response. So on your screen, you should be seeing which is a dashboard or a breakdown of COVID-19 in our community. So this is hospital capacity, and I'm going to kind of click around to other things. Just showing you a case summary first. In Ottawa County, which is the county just north of Allegan County, we've had 904 cases of COVID-19 that we've counted since this started about mid-March, and about 47 deaths. So we have a case fatality rate of about 4.5%, 5%. We love to see that number lower, but this is part of my job, is counting COVID-19 cases and the deaths that happen. We also put up all kinds of great information on the proportion of cases that are hospitalized, the breakdown by male or female, the breakdown by race and ethnicity. Ethnicity is a category of Hispanic or non-Hispanics or Latino. We also count the cases by age groups. And so we can see the cases that are most affected or where the proportion is the highest is among those that are between the ages of about 20 and 50. And then if you look over here on the right-hand side, you can see the number of cases that we've had each day. I'm happy to say that our numbers in Ottawa County have rolled over and have started to go down, but we continue to keep a close eye on that. We have all kinds of additional information about what's going on in our community, one of which is how much testing we've done and how many tests are coming back positive. We're also keeping a close eye on, and one of the things that epidemiology does is just make sure that we have capacity in our county if there's a spike in COVID-19 for us to make sure that if people need healthcare, if they need to be hospitalized, that there's enough healthcare for them to access. And we do have that. Like here in Ottawa County right now, we have enough ventilators that are available for people to use. And we have enough inpatient beds and we have enough ICU availability. These are things that we keep an eye on because not only is epidemiology part of keeping track of diseases in the community, we're also here to help respond and direct and guide resources. So that's kind of just a snapshot from COVID-19, and that's the really, really highlight stuff. We also do all kinds of stuff with policy development, planning for things like mass clinics and helping to direct the best places to direct our resources. So kind of moving back to our PowerPoint in a second. So COVID-19 is one of the things that we work on for sure. We also work on a number of additional items. One of them is Lyme disease. And I just wanted to bring this up because in Allegan and in Ottawa County, you can see that we're red highlighted counties. And in June and July and August, there's a lot more tick activity, which is the bug that carries Lyme disease. So epidemiology, one of the things that we do is just try to find out where diseases are occurring. You can see here that over time, we've learned in Michigan that there are places that have known risk for Lyme disease, of which Ottawa County and Allegan County, where Fennville is, are areas that have known Lyme disease risk. So if we know about it, we can share with the community and protect ourselves by using appropriate sprays or avoiding places where ticks are more active during the summer months. June is a really important month because there's a number of smaller, younger ticks that are out there that can carry Lyme disease but are harder to detect and find on your skin. So we tend to see more Lyme disease cases at the end of the summer after people have been bitten in June and July and demonstrate symptoms in August. So we're keeping a close eye on this right now. We also keep track of lots and lots of other things, not just contagious diseases like COVID-19 and Lyme disease, but also other health events that are really important to our community. So maybe some of you have heard about the opiate epidemic that's across America right now. It's really part of the deaths of despair. And maybe you haven't heard about these things. Take a peek at it, Google it, look up the overdose, the opiate epidemic, and just learn more about what's going on because this impacts every community in the United States. So here in Ottawa County, we're keeping track of the number of cases that we get every year, so we can identify if there's a particular trend. This is what we do in epidemiology as well, see if the numbers are going up or if they're going down. If they're going up, what can we do about it? If they're going down, what can we learn from it so that we can do the same thing in other places across the country? So we're always working to try to prevent diseases and also other health events like overdoses. So kind of backing up, just talking about the things that I love about epidemiology is, one, I'm always learning. Two, I'm working in a field that's affiliated with healthcare. So I can be working with patients and clients, but I can have an opportunity to have a bigger impact. So it's not just me and the patient, it's me and the community, which means that although my direct impact may be small at a personal level, I can have a bigger voice across the whole community to hopefully influence change for the better. I also have great work-life balance. I come to the office, I do my job. Even though I do some night and weekend work, most of the time I can determine my own schedule. So I don't usually take my work home with me and can pursue other things that I enjoy. In addition to outside of work, I do really, really love my work. I enjoy the data, the programming, managing outbreaks, developing studies, and even writing policy. And at the very end of the day, I love it because I get to serve people. So I have this unique opportunity and just really, really enjoy my work. If you're thinking about epidemiology, there are lots of careers out there. Biostatistics, working in communicable or infectious diseases. You could even work on stuff like obesity prevention and smoking reduction. You can work in genetic epidemiology, injury prevention, like trying to prevent car crashes, or working with folks that are working in oil and gas and how to prevent injuries while you're working on oil derricks or oil rigs. Those are all really, really important parts of injury epidemiology. You could work in environmental epidemiology. So how to prevent people from getting exposed to things like pesticides or asbestos. You can work in programming and data analysis, or you could even teach. So there's tons and tons of options out there. So if you're thinking about epidemiology today, just kind of highlights again, you could teach in academia. You could work like me for the government in a public sector, either for like a county like Allegan or Ottawa County, or for the state of Michigan. You could work for the Centers of Disease Control and Prevention, or you could work globally if you want. You can go work in Africa or any other country that has higher health needs, or you can work in a hospital, work as a consultant, or work for one of the big companies in injury prevention or wherever else people need epidemiological support. So tons and tons of opportunity. When you're thinking about epidemiology, the career field, there's still a lot of room for growth. And from everything I've read, it looks like there'll be continued need for epidemiology in the years to come. There are lots of jobs out there, but you might have to move. I had to move a couple of times. I found that living in different places was really, really fantastic. And I got to experience new cultures and new geographies and learn about lots and lots of new things that I could take back here to Ottawa County and use those experiences to help people that live here through my work at the health department. And a lot of times I get asked is, what's the salary range? Not just from high schoolers and college students, but when I've talked to middle schoolers, they're interested too. Is, will I be making enough money to pay the bills and also like pursue my other passions? And in epidemiology, usually people are making between $55,000 to $70,000 a year. You can pay your bills on that salary. If you look up there right now, on average, and this comes from Indeed.com, people are making about $30 an hour. So that's about $60,000 to $62,000 a year is the average, but that varies depending on your skills, experience, and the level of responsibility for the job. So there's a lot of variation in the compensation. So hopefully this gives you a good snapshot of epidemiology, my job, and hopefully it can inspire you. Just want to encourage everyone here to pursue your dreams. You've got a long time before you're thinking about a career, but maybe this could be something for you to think about in the years to come. So thank you for having me, and I wish you all the best, both as middle schoolers, but also as people who are eventually going to be the workforce of the United States going forward.